Arrhythmia is something many people have experienced without even realizing it. Maybe your heart suddenly felt like it was racing, skipping a beat, fluttering, or beating irregularly. While occasional changes in heart rhythm can be harmless, some irregular heartbeats can affect how efficiently the heart pumps blood and may even become life-threatening. This condition is called arrhythmia, and it affects millions of people around the world. So what exactly is arrhythmia? Arrhythmia is a condition in which the heart beats too fast, too slow, or irregularly. Normally, the heart follows a steady rhythm controlled by electrical signals. These signals tell the heart when to contract and when to relax, allowing blood to be pumped efficiently throughout the body. The heart's natural pacemaker, known as the sinoatrial node, generates electrical impulses that travel through the heart muscle. This coordinated electrical activity creates a normal heartbeat. However, when these electrical signals become disrupted, the heart may beat abnormally, resulting in an arrhythmia. There are several types of arrhythmias. Tachycardia occurs when the heart beats too fast, usually over 100 beats per minute. Bradycardia occurs when the heart beats too slowly, usually below 60 beats per minute. Some arrhythmias cause the heart to beat irregularly, while others cause extra or skipped beats. The symptoms of arrhythmia can vary from person to person. Some people may feel heart palpitations, dizziness, shortness of breath, chest discomfort, fatigue, or fainting. In some cases, arrhythmias cause no noticeable symptoms and are only discovered during medical examinations. Arrhythmias can occur for many reasons. Common causes include heart disease, high blood pressure, electrolyte imbalances, stress, excessive caffeine consumption, smoking, certain medications, and damage to the heart muscle. In some individuals, arrhythmias may be linked to inherited conditions affecting the heart's electrical system. The understanding of arrhythmias has improved significantly as scientists studied how electrical signals control the heartbeat. This knowledge has allowed doctors to develop advanced diagnostic tools and treatments that help manage abnormal heart rhythms. While some arrhythmias are harmless, others can increase the risk of serious complications. Certain irregular rhythms may reduce blood flow to the brain and other organs, while others can increase the risk of stroke, heart failure, or sudden cardiac arrest if left untreated. Treatment depends on the type and severity of the arrhythmia. Some cases require only monitoring and lifestyle changes, while others may need medications, pacemakers, electrical procedures, or catheter-based treatments to restore a normal rhythm. Today, artificial intelligence is helping doctors detect arrhythmias earlier than ever before. Smartwatches and wearable devices can continuously monitor heart rhythms and alert users when irregular patterns are detected. AI algorithms analyze thousands of heartbeat recordings and can identify abnormalities that might otherwise go unnoticed. In hospitals, AI systems are helping doctors interpret ECG results faster and more accurately, improving early diagnosis and treatment. Arrhythmia is a condition that affects the heart's electrical system and can change the way the heart beats. Understanding how it develops helps us recognize the importance of heart monitoring, early detection, and proper treatment to maintain a healthy heartbeat. But what happens when blood stops flowing smoothly and forms a dangerous blockage inside a blood vessel? In our next video, we'll explore blood clots explained and discover how they can lead to serious conditions like heart attacks and strokes.